Hi, I'm Bill Leinweber, Executive Vice President and Chief Executive Officer of the American Academy of Physician Assistants. Over the past few weeks, we've witnessed a lot of angst and anger at congressional town hall meetings around the issue of healthcare reform. I think these town hall meetings are at their core a wake-up call that one major stakeholder, the American public, is not receiving adequate information about the importance of healthcare reform. If the American public is better informed about what's at stake and what's in the bills, I believe they will provide broader support resulting in truly meaningful healthcare reform. I know that AAPA members, and in fact all PAs, also have questions and concerns about healthcare. I'd like to address some of those concerns today. The Academy believes that PAs are a critical part of the healthcare workforce and an integral component of meaningful healthcare reform. In order for this to happen, Congress must do the following: invest in expanding the PA workforce, resolve current barriers to care provided by PAs in federal programs, and fully integrate PAs into new models of care, allowing them to develop care plans, provide care, and coordinate care through medical home and chronic care management models. The Academy has been very active in healthcare reform. Our federal affairs staff has engaged in extensive lobbying activities on Capitol Hill. AAPA leadership has met with high-level members of the administration in the Office of Management and Budget and the White House Office of Health Reform. And we continue to encourage AAPA membership to become engaged in healthcare reform using new tools on our website. So far, 4 of the 5 House and Senate committees with jurisdiction on healthcare reform have marked up healthcare reform legislation. Right now, the staff of the 3 House committees are merging the various bills into one. The Senate Finance Committee is expected to release its healthcare reform plan by September 15. It's still too early to tell how AAPA's principles on universal coverage, affordability, and other matters will be addressed in healthcare reform legislation. On the PA-specific issues, we've done very well. The Senate Health, Education, Labor, and Pension Bill includes a 15% carve-out for PA educational programs through reauthorization of the Public Health Service Act's health professions programs. All of the bills marked up thus far recognize the role of PAs in providing quality medical care and integrate PAs into the medical home and chronic care management models. In the Energy and Commerce Committee markup of healthcare reform, we came close to addressing 2 Medicare issues: allowing PAs to order skilled nursing facility care and providing hospice care. Unfortunately, the amendment was not allowed because of technical issues. Still, there are supporters who are working to include the 2 PA Medicare provisions in the final House bill. And we continue to work with the Senate Finance Committee on all of these issues. AAPA has not endorsed any of the House or Senate healthcare reform bills, but we have endorsed legislative language that's been included in some of the bills. We've also supported inclusion of PA-specific language to healthcare reform. I would like Academy members, in fact all PAs, to take advantage of every single tool we have available: the AAPA Legislative Action Center, the August Mobilization Plan, the Academy Hotline to Capitol Hill, the PA Week Toolkit to phone, email, or meet directly with federal legislators and legislative staff on the Academy's long-standing healthcare reform principles and the integral role of PAs in a reformed healthcare system. Thanks to strong advocacy by PAs, there's a lot of goodwill for the PA profession on Capitol Hill. And that's because the PA message on healthcare reform is always a patient-centered message. I encourage PAs to continue to be strong advocates, focusing on the needs of their patients. Thank you for your critical role as a physician assistant, and for your advocacy on meaningful healthcare reform.